Thanks, Shane. As I said earlier, I'm going to share with you today the details of the campaign that we've actually been running in the UK for better access to care and services and treatment to treat our alphas in the UK. We hope you'll be able to take away some of the information and things that we've done in our campaign and use it in your countries to improve care for alphas in your countries. So the first things, just run over what I'm going to cover in the presentation. I'll tell you about who the Alpha One Alliance is and why we need to campaign and our campaign strategy that we've used to date. I'll also tell you about the National Patient Survey that we undertook to profile the unmet medical need of alphas in the UK, and I'll give you some examples of the campaign activities that we've undertaken. I'll tell you about some of the achievements we've made and also what we're going to do to continue our campaign. So the Alpha One Alliance was actually formed in 2012, and it's a coalition of Alpha One patients and clinicians from across the UK. And our objective was to profile the unmet medical need of Alpha One patients and to also campaign with ministers and healthcare officials for better services and care for Alpha One. And that was to be established via the establishment of national services for Alpha One patients, giving us coordinated, integrated and multidisciplinary clinical care delivered through a few expert centres throughout the country. And that would lead to better and more equal access to treatment and rapid access to any forthcoming licensed medicines. So why do we need to campaign? Well, like the health services in your own countries, our funds are not unlimited within the UK. And as belts are being tightened now due to the current economic climate, and there's also rising healthcare costs, so that puts pressure on our governments to keep those costs contained. Our healthcare systems generally focus on the most common of diseases, and we're alphas, we're fighting along with the other rare disease communities for the same funds which are limited, and not everybody can access all of the funds. But what we do know is that the patient opinion is becoming much more important, and our voice is being heard, we're being listened to, and it does make a difference. So we realised that to bring Alpha One onto the political agenda, we actually had to make sure that the Alpha One patient community and the clinical communities were both speaking with one voice, delivering the same clear message. And we needed to deliver that to the government and the National Health Service. Our voice needed to be heard by everybody who was directly or indirectly involved in influencing the health service decisions and the budget allocations. So the key elements of our campaign strategy was to actually profile the unmet medical need of alphas, because we needed to demonstrate the areas of care that patients felt needed improvement. Our strategy was also to raise awareness of the unmet medical need that we'd highlighted amongst the clinicians, the health service officials, parliamentarians, the government. And it was key to establish and maintain and foster the relationships that we had with our campaign supporters and the relevant stakeholders that we have at local, regional and national levels. We understood that we had to get actively involved in the political and the administrative process, and we're convinced that this strategy will lead to sustainable improvements in care. So what I'm going to do is actually tell you about some of the things that we've done to date to achieve our campaign strategy. So at the beginning, we realised that we needed some data to actually justify the call that we made for improvements to care for alphas in the UK. So the first thing we did was we undertook the first ever national Alpha 1 patient survey, and we used an online tool to do that. And we had approximately 200 people complete that survey from the patient community. And it demonstrated a high level of the unmet need of alphas in the UK. And I can't really go into all of the specific details of the whole outcome of that, but it did show that we didn't have full access to therapies, and we had inequitable and restricted access to services. We've got a lack of integrated multidisciplinary care, so the care is very fragmented, and we want it to encompass all aspects of Alpha 1, lung, liver, transplant, and also paediatrics. So I'm going to show you some of the examples that we've actually done to date and how we implemented our strategy. And the first thing that we did was the survey, and that enabled us to produce our policy reports. I've got a couple of the reports. I didn't bring too many, obviously, due to travel weight restrictions, but I've got the 2 reports here that you can have a look at during the breaks, or you can also download them from our website, which I'll talk to you a little bit about later, but they're available here to view or download. And they contain the actual detailed survey results and also policy recommendations based on the patient's opinions. There were forewords written by members of Parliament and leading Alpha 1 clinicians to support the campaign for care. And these policy reports have actually underpinned all of our discussions with all stakeholders. Once the reports had been produced, we actually launched them in the English and Scottish Parliaments, and we had seminars at both parliaments, and we had panels of speakers with patient representations, expert Alpha 1 clinicians, members of Parliament, and there were senior Department of Health representatives and government representatives. The event also attracted a lot of patient interest, and they also attended along with other members from the clinical community. So we obviously needed to also raise awareness of our campaign within the wider clinical community as well. And we produced flyers to be included in all delegate conference bags at the British Thoracic Society Winter Conference. And we did that 2 years running in 2013 and also 2014. That's just one of the things that we've done. We've also tried to actively include and gain support from the clinical experts. And in June last year, we held an advisory board with national and international expert clinicians. You probably recognise a lot of them. And we wanted to agree on how our service would look and what specifics needed to be covered within the clinical service. And we're really pleased that all of the participants at that advisory board meeting signed a consensus statement which supported the Alpha 1 Alliance's formal application to the National Health Service for a service for alphas in the UK. So we'd actually, to this point, surveyed the patients, actually seen the unmet needs that we had, and we put all of that into our policy report, and we gained support from the clinical community. And we needed to then raise awareness within the government. And we undertook a petition which called on the Department of Health for a national service for Alpha 1, with also access to augmentation therapy. And we had over 2,000 signatures on the petition that we delivered. That was delivered to Westminster, to Downing Street, and we received a letter from them acknowledging our views and also receipt of our petition. We've then also additionally met with a lot of political figures in England, senior politicians. So it's just a few photographs to show you. This is the former and current Shadow Secretary of State for Health. He could also be the new Secretary of State for Health after the general election. We'll need to wait and see. We've also met with the current Secretary of State for Health and the former Secretary of State for Health as well. He's been responsible for a lot of the major reforms within the healthcare system in England, some of which we're having to deal with at the moment. And it was important that we engaged with the formal process to apply for our service within the UK. And the results from our survey, the policy report that we produced, underpinned our call for better care. And this is an example. I won't go into detail on this because this is the process that we have to go through in the UK. The process in your countries will be completely different. So it's a complicated system. You need to go to a number of boards to actually get approval to go to the next stage in the process. And we've obviously engaged with all of these stages as we've needed to do. A lot of the stages in the process actually also enable patient engagement. So we've encouraged and actively done those things. Your system's going to be different within your own country. So I said I'd tell you a little bit about the website and what we used it for. So we produced the website to enable us to share the information and facilitate the patient and stakeholder engagement in our campaign. So we've used it to inform and update the stakeholders, our sponsors, and the general public and patients of the campaign and any news that we wanted to share. It enabled us to facilitate direct communication between alphas and their local MPs, and we were able to automate that process. We provided template letters for our patients that they could customise and send to their politicians. And we've provided electronic copies of our materials to support the campaign. Like I said, you can download the policy report from there as well. And we've also advertised events and invited participants to attend so that we didn't have to do that manually. And we've shared that information then and pointed patients to our website via Facebook and other social media tools. So this is what the actual website looks like. And you can see just here, you would click on this link and in 3 easy steps you'd be able to actually email your MP or your MSP in Scotland. And you can download the policy report here for England and for Scotland. So quite similar to Canada, but without the same number of areas. We have to deal with different areas and different policies. So this is another area of our website. This is the news area. So you can see all of our news releases here and links and some photographs of whatever it is we're doing or information that we want to share at any time. So at this stage, we've got the summary of our achievements. We profiled the unmet medical need of alphas in the UK by the survey we undertook and the production of our policy report. We've actually put Alpha One on the political agenda and obtained backing from a lot of key politicians who've supported our campaign. We've also gained support from the clinical experts in the field of Alpha One, and we've actively engaged in the process to formally apply for the service to improve care for alphas in the UK. And we've made significant progress in establishing the National Service for Alpha One, delivered by a few centres, giving us the coordinated and multidisciplinary care to national standards that we need. And we obviously need to continue our campaign. We don't have a service as yet, so we continue. And we continue to make sure that the patient's voice is heard, to ensure that Alpha-1 remains high on the political agenda. We will continue to raise awareness of Alpha-1 within the clinical community. As has been said earlier this morning, there are still lots of clinicians who don't know about Alpha-1. Things are getting better, but there's more to be done. We'll continue to engage with the National Health Service and the senior politicians to facilitate the approval for the service of Alpha-1 in the UK. And we'll need to continue to build parliamentary support so that they can put pressure on the National Health Service. And once the general election has been held in May, we'll either need to meet to sustain the support we've got from current MPs or to gain support from newly elected MPs. There's also going to be uncertainties and events that we'll have to overcome as we go along. We can't foresee everything that's going to happen. And at the moment, we're currently engaging another public policy affairs company to actually represent us and support us in our campaign.
Sorry, Karen, could we close now?
Sorry?
We're a bit over time, quite a bit over time.
Not.
Nearly there.
It says I've got 3 minutes. I'm not there. So I've got 2 slides. This is it. Okay. So our challenge is we still, with the NHS, face continuous budget restrictions. So Alpha-1 is rare. We all know it's rare. That's a challenge that we face. We've got more competition, as Laura was saying, for restricted resources within the rare disease community. There's an increasing number of high-cost orphan medicines coming to market. There's changing dynamics within the politics, and with the general election, we don't know what's going to happen after that, so we'll need to wait and see. And we've currently got a lack of marketing authorisation for any specific therapy for Alpha-1. So I'd like to thank our sponsors at this point and our supporters and you for taking the time to listen. And I hope you'll be able to take some of the information that I've shared with you to actually increase care for alphas within your own countries. Thank you.